Today I am going to share with you how I use specific self-care tools with specific patients. I'm going to present to you a couple of case studies with changed names, of course, for privacy. Hi, everybody. Thank you so much for tuning in. I'm Dr. Gina with Holistic Health Journeys for Women, and I have helped over 2,000 women and couples to become pregnant with babies. And oftentimes, 38% of the cause of infertility is due to endometriosis. So thank you for tuning in. And if you see what you like here, absolutely subscribe, because then you'll get the little notification when I release more videos. And I would just really appreciate you doing that. So let's get to it. Self-care things that I do to help patients and clients to improve endometriosis is focus on a calendar of self-care that is selected specifically for each patient and their holistic diagnoses, and then specific concern areas, something that may not even seem like it's endometriosis related, like migraines or IBS, but all of these things, right? They can cross over and irritate each other and make things so much worse. So I use a heavy focus on reducing inflammation, invigorating blood, focus on an improved diet that revolves around Mediterranean diet that I have touched on and gone over in fertility food diet videos as well. So definitely check those out. Daily stress reduction techniques, and focused on a solid sleep hygiene protocol every single night. And I will get into even more details with that in this series of endometriosis. But let's talk about my first patient that I'm presenting today, Jen. So Jen came in. She had extremely painful periods and ovulation time. Horrible. Even ovulation was even worse than her menstrual cycle. At 25 years old, she came and said, I can't take it anymore. I want to have a hysterectomy. But she really wanted to have one child. And her relationship wasn't there yet. She's 25. She's like, we're just not there. And I'm not going to push to have a child so soon, all that comes along with that. So here's a side note. Hysterectomies don't always relieve endometrial. They don't always relieve recurrences or prevent recurrences of endometrial tissues growing back. So keep that in mind, because I hear often, and I see in a lot of groups online, that women are considering hysterectomies. So what was part of her specific treatment plan was sleeping. Her sleep was very erratic in different times and staying up late. And often that will cause more pain and just more deficiencies with blood. And that can create more blood stasis, which is one of the bigger causes of endometriosis, but there are a few. So I asked her to really just kind of hone in on her sleep protocol, and we did a few things, but ideally she would be rested, no screens, all that, at least 1 to 2 hours before bed, and then also eating at least 2 to 3 hours before laying down horizontally. So her goal was to go to bed at 9 p.m., asleep by 10 p.m. And she had been going to bed at 12 or 1 in the morning, so it takes time. You can't just say, okay, I'm going to start going to bed at 10 o'clock, because we don't work that way. Our bodies get into these habits. So usually, based on research, you can try, say you go to bed at midnight and you want to start going to bed at 9 and asleep by 10. So roughly around every 3 days, you go to bed 15 minutes earlier. So the first couple days, you go to bed 11:45, 11:45, 11:45, then 11:30, 11:30, and so on until you get to 9 o'clock. So it takes a little bit of time to get there, but it's a more natural process and it'll stick. That's what's important, right? So with Jen, we also use herbs, and the focus for her, she did have a lot of blood stasis. She had very large clots, almost like hemorrhaging, like bleeding. So we did invigorate blood. But once we got out of the pain and out of the period and past the clotting and all of that, when she was towards the end, we'd start to nourish the blood with herbal medicine, but also with specific foods. So we looked at specific proteins and dark leafy greens, and not eating raw foods, because that can congeal blood and make it harder to go through. It also can upset digestion, which can lead to more cramping. So this was not an overnight adjustment for her, okay? We also added in external foot soaks, and we focused on herbs that invigorate blood circulation, and we started those at ovulation. We didn't wait for the pain to start, the period pain, right? So she started them, for her it was around day 14, 15, and she would do a blood invigorating foot soak every day and use that until her period started. And sometimes if she still had debilitating pain, she would continue those until the pain lessened. She was also taking internal herbs for the pain as well. And that was, again, like increasing blood circulation. And her diet was way more balanced, no more fast food or greasy food. She really had it convenient for her. There was like this is when I was practicing in California, so there's like an In-N-Out burger was one of her favorite things. She'd have these like strong, salty cravings and greasy, which is common when you're in pain, and it's like a comfort food for some people. So she really tried hard, and we worked on food prepping and that kind of thing. But also the major thing was really increasing protein intake. And again, like not eating raw vegetables because that's too challenging on digestion, and that can actually contribute to having pain. So everything for her was lightly steamed, sauteed, or eating vegetables with prepped soups. So Jen's outcome after 6 months of like total commitment, again, it was not an overnight. It was like every 1 to 2 weeks, she was going to add in like one more thing and not make it stressful. It had to be easy and doable in her schedule because she did have a busy work schedule. But after 6 months of treatment, she had regular periods, more manageable pain, much less detection of lesions because she was working with a very open-minded Western doctor that was tracking her progress. A much more minimal detection of lesions outside of the uterus. She did not have a hysterectomy, and she has 2 children. Wow! Yay! Okay. Next patient, Stacy. Stacy I've talked about in some of my other videos, but she was one of my first fertility patients and no symptoms. So this is odd, right? A lot of times I have people come to me because they're in so much pain, they want to get out of the pain, but she had no symptoms. But she could not get pregnant. So she was diagnosed with infertility due to endometriosis, which is the cause of 38% of the diagnoses of infertility. Often it goes undetected until you're having challenges. So unfortunately, Stacy, oh my gosh, because this was 22 or so years ago, she had 8 IVF cycles that did not work. They did not end in a pregnancy. This is what we worked on. Stress reduction. She said, I eat great, I do all this, I don't feel super stressed, but she did have a lot of stress at work. She had a lot of challenges. She didn't have regular lunches. So stress reduction. We worked in daily walks for 30 minutes at lunchtime every day. No more sitting at her desk and just snacking on, again, like quick foods, not necessarily fast food all the time. And our big challenge was reducing sugar intake. She had a very sugary comfort drink that she drank every day when she got stressed, but it made her feel good. It made her think of her childhood years, but it was keeping that inflammation up. So that took probably the longest out of all the recommendations to take out of her diet. I won't go into that whole story. It's just, she's my first patient with infertility. Reduce inflammation. We did that. We did that with diet changes and then also with the stress reduction. Absolutely. And then we added in supplements and very specific blood invigorating herbs. She didn't really have the pain around her period, but she did have a touch of clotting. But again, like that was her diagnosis. And we did add in foot soaks that we used day 14 start for her. And then she didn't have as severe cramping, so she stopped the foot soaks once her period came on. And this was to help with the circulation. And also that can break up lesions and break them down, which is exactly what we want, right? And then prevent reoccurrence. And we also added in more protein to her diet. So the outcome for Stacy was a beautiful little boy 9 months later after lifestyle and self-care improvement. And she was able to have a baby after 8 failed IVF cycles, or I should say 8 tried IVF cycles that did not wind up. So her 9th cycle was her successful pregnancy story. And I have worked with thousands of women and couples to help support them on their infertility journeys. Endometriosis, unfortunately, is a huge cause. As I said, it's like 38% diagnosed cause of infertility, but really women go so long sometimes and they never even get diagnosed. Probably we're looking at closer to it being like 50% of people with endometriosis having infertility. But it does not have to be a barrier anymore. You have options and many things that you can add into your daily routine to help you to beat endometriosis and its limitations regarding fertility and your overall well-being, right? It's not just the physical and the pain, which is debilitating, excruciating. There are so many other trickles. It's the snowball negative effect, because it can impact personal relationships, work relationships, relationship intimacy with your partner if you're having discomfort. So thank you so much for tuning in, and it would be great for you to subscribe, and then you'll get the next one. I've got at least one more video in this series about endometriosis, and I would love to help you as well. The next episode walks you through the 3 top and easy add-in self-care techniques that you can start right away. I will see you there.